Lung cancer screening is important because the sooner we can identify that a person has lung cancer, the sooner treatment can not just be treatment, but actually a cure.
Every year, 2 million people are diagnosed with lung cancer worldwide. Well, today, Lung Cancer Foundation of America, LCFA, is raising awareness about lung cancer.
Today is World Lung Cancer Day. It's a time to raise awareness about screening for lung cancer, the importance of lung cancer research, and the significance of something called a biomarker. Diane, what on earth is a biomarker?
Biomarkers are features of lung cancer tumors. They're a way of identifying the specific type of lung cancer you might have. So biomarker testing is precision medicine that actually looks for changes in the DNA of tumor cells. And as you'll see in our next video, identifying your biomarker can lead to a more targeted treatment of your lung cancer.
Now, before we roll the video, you should know that the person doing the interview in this video is a patient advocate hero. Her name is Ivy Elks. Ivy bravely battled stage 4 lung cancer for more than 9 years, and she lost her battle earlier this year. One of her dreams, though, was that her voice would still be used to help others facing lung cancer. Ivy was quick to remind others that a stage 4 lung cancer diagnosis 10 or 15 years ago was nearly a death sentence, but not anymore, not with today's advances.
Ivy always told diagnosed lung cancer patients to ask their doctors this key question: what is my biomarker?
Hi, I'm Ivy Elkins, and I am a lung cancer patient and advocate. And I am here with Dr. David Carbone today, and we are going to talk about biomarkers through Hope with Answers. So my first question for you, Dr. Carbone, is I hear a lot about biomarkers. Could you start out by telling me what is a biomarker?
Well, a biomarker is just a feature of a cancer that we can test in the laboratory to help us pick the best treatment for each person's cancer. And as we learn more and more about the different types of cancers and the different subsets of cancers, each is sensitive to different approaches, and we have to characterize the cancer beyond just telling us whether it's cancer or not cancer. And those are biomarkers.
Are there some biomarkers that patients might have heard of before?
Well, patients might have heard of EGFR as a biomarker.
Mm-hmm.
That stands for epidermal growth factor receptor. That was one of the first important ones discovered, and still is a crucial biomarker to test for in what's called non-squamous, non-small cell lung cancer.
Now, what's non-squamous non-small cell lung cancer? See, it's a mouthful. I can't even get it out.
Well, lung cancer is divided into types. There's small cell and non-small cell. And then within non-small cell, the two major categories are squamous and adenocarcinoma. And those are types of non-small cell lung cancer. And most of the gene mutations we were talking about are in non-squamous or the adenocarcinoma part of non-small cell.
Okay.
And that really refers to how the tumor looks under a microscope. And it's kind of an old-fashioned way of telling one tumor from another. And we know of much more specific and much more therapeutically impactful differences now through the marker testing.
Okay, I understand. Should all patients be tested for biomarkers?
Nowadays, I would say all patients, both squamous and non-squamous, should be tested for some biomarkers. Different ones for different subsets of tumors and for different patients. But I think that that's a discussion that you should have with your doctor about the importance of getting a complete panel of testing done and doing it before any treatment is initiated.
Thank you so much, Dr. Carbone. This has been very helpful. Thanks for joining us with
You're
Hope
welcome.
with Answers.
Close your eyes and think of someone who is battling lung cancer. What do you see? Do you see someone who's a frail elderly smoker who is bald and bedridden from the chemotherapy treatments? Probably that's not far off from what you think about. But Florida resident, Lysa Buonanno, well, she doesn't fit that stereotype at all. Lysa is not bald, and she's not bedridden, and she's not a smoker. She's very much alive, and she loves sharing her story of hope. Take a look.
Amazing, isn't it? So is the fact that I've been living with lung cancer for over 12 years. My name's Lysa Buonanno, and I've been lucky enough to be in a clinical trial for just over a year now, and I feel fantastic. So good that I get to walk on the beach every day. If you'd like to learn more about lung cancer, go to lcsamerica.org.